Hey everybody, thanks for being here today. It's me, your friendly neighborhood science teacher, and today I'm going to be going over with you some basics about scalpel use, how to use them correctly, as well as some tips overall for the dissections that we will do throughout this course. There are specifics that we will not go over because those relate only to those specific dissections, but we'll go over the general procedures to use and the general types of cuts that we will perform. Now, a lot of the things here are going to be different than other videos you might research on your own because what we are focusing on here is dissection. A lot of videos that you look for online will deal with how to do these types of things in a surgery. In a dissection, we are not so worried about wound care or if that wound is going to heal correctly because it's not going to heal at all. And so some of the things that we do for dissection are not things that you would do in a surgery because we are not worried about the wound or the subject or the patient healing. And we do these for speed or to isolate different structures more easily. So you're going to practice these skills, and with time, no doubt, you'll be a cut above the rest. Now first, we're going to go over the basic tools that you'll be using throughout the year for dissections. Here we have a dissection pan. I've chosen not to use the rubber insert. Instead, I'm just using a couple of paper towels to aid in cleanup. A few types of forceps. These are straight tweezers. These are tissue tweezers that taper at the end. These are mosquito forceps. They have a ratcheting mechanism, which means that when you close them, they will stay closed and stay pinched. To unclip them, you would undo the ratchet mechanism like that. We have straight dissecting scissors. We have scalpel handles. They come in two different sizes, size 4 and size 3. Scalpel blades, the number of the blade indicates the size, and those are embossed on the container as well as the blade themselves. 20 and 10 are the two that I'm choosing today, though there is a series that is in the range of the 20s, like a 21, 22, etc. They're all different shapes. Similarly, there's a series, the 10 series, and those are 10, 11, 12, 15, and they also have different shapes. The 10, though, any 10 or any of the 10 series would go on a number 3 scalpel, and any of the 20 series would go on a number 4 scalpel. And lastly, we don't want any sharps going into the garbage, and so we've got different types of sharps containers. What I've got today is a film canister that we're going to be putting our scalpel blades in. So next we'll look at a scalpel blade, how to put them on, and the different parts. To open the scalpel blade, you'll peel them carefully. So here you can see that these are the same shape, but are different sizes. The 20 would be the correct size to go on a number 4 scalpel handle, and the 10 would be the correct size to go on a number 3 scalpel handle. They are meant for, these are meant for larger, deeper, and more forceful cuts. These ones are made for more delicate cuts. On the scalpel blade, you can see the number. To put on the blades, you could do them with your bare hands, but you wouldn't do that in surgery because of the risk for infection or cutting through gloves if you're wearing gloves. And for safety's sake, we're also going to be, in this course, asking you to use the mosquito forceps to put them on. When you put them on, the diagonal here on the handle needs to match the same angle as the diagonal on the blade. So it needs to go on like this, not like this. Those diagonals do not match, and this would not fit in this orientation. So you can use the mosquito forceps to grip the end of the blade. You'll check in the handle to make sure that there's nothing in this groove obstructing it, because that's where the blade is going to go. You put the handle into the notch for the handle into the blade where it's going to go into that groove and gently push on until it clips. Then you can remove your forceps. To remove the blade, you need to grab it at the back, peel it up, and then push forward. To discard the blade, it would then go into the sharps container. Now there are a few different parts to every scalpel blade. You have the spine of the blade, you have the tip of the blade, you have the slot in the middle, which is where the handle is going to attach, and you have the sharp edge, which is this part here, and on this one here. Now that you've got your scalpels set up with the blade, I'm going to show you a couple of ways to hold them. There are different ways to hold the different scalpels for different types of cuts, as well as the different types of handles and blades for different types and depths of cuts. For the most delicate cuts, you're going to be using what's called a pencil grip. With a pencil grip, they talk about a tripod for a grip, which means that you are gripping the handle of the scalpel in 3 places: the pad of your thumb, the pad of your index finger, and the pad of your middle finger, just like you were writing with a pencil. If people write this way with a pencil, it's because you have poor writing form. You really should be holding it out like this. This is for the most delicate cuts. For curved cuts, you would move and rotate the scalpel handle, and you're cutting toward you with a pencil cut. You can stabilize your hand on the subject or on the specimen using your pinky. There's a reverse pencil grip, which is the same as the pencil grip, but it's for cutting away from you, either like this or a little bit more angled. You still can rotate and get curved cuts, and you're cutting away from yourself in this case. For deeper cuts or through a tougher material, you would use a butter knife hold. So again, the pencil grip is here with the handle outside of the palm. For a butter knife hold, the handle is on the inside of the palm. You stabilize with the pad of your thumb. You apply force with the pad of your index finger, and you use the side of your middle finger for stabilization. I'm going to show you some examples of different cuts on some different specimens. The first type of cut I'm going to demonstrate is a straight, shallow cut, and that's going to be using the pencil grip. In addition to not wearing gloves, because this specimen is not in preservative, and because infection is not an issue here for this cut that I'm going to make, I am not wearing gloves because I get a better grip on the scalpel. In addition to that difference for a dissection versus a surgery, the direction of the cut in a dissection can be better suited to what the purpose of the dissection is, whereas a surgeon will typically plan cuts along what are called tension lines. Tension lines are the lines of tension on skin, and you can kind of see the tension lines when you gently pull skin together, the lines that the wrinkles form in, those are the tension lines, and a surgeon will plan cuts along tension lines for better healing. As I said earlier, I'm not worried about how this specimen is going to heal, and so the cuts can be suited to the goal of the dissection. For this, I'm going to be removing the skin and isolating some muscles as a demonstration. Using a pencil grip, a straight, shallow cut. Another difference between how a surgeon would make an incision and how you might do it for a dissection is that in dissection, you can use the very tip of the scalpel to make sure that you're going to start and end at a very specific place when you make your cuts. A surgeon, though, to minimize damage to the tissue, is going to use the curved part of the blade to start and end the cut. In both cases, we really want to make sure that the scalpel is perpendicular to the specimen, not angled here or here, but perpendicular. It means that you're going to cause the least amount of trauma to the skin. And for some dissections, you may realize that you do want to cut at an angle, but a surgeon, again, to cause the least amount of trauma to the skin and promote the best healing, is going to cut perpendicular. Another difference between a dissection and a surgery is that we, in a dissection, really want to preserve what's underneath, and we understand that people have less experience, and so making multiple slight cuts is better than making one cut that ends up being too deep. Surgeons practice and have reference materials to know how deep skin is at different points of the body, and they really try to make just one cut for their incision, again, to reduce the amount of trauma to the skin and to promote healing afterward. And now here I am demonstrating that same shallow straight cut on a line, pencil grip, using either the curved edge if you want to do more of a surgery type incision, or the pointed edge if you want the most precision. Trying to apply pressure and one smooth movement. Next, I'll demonstrate a curved shallow cut, and that is going to be using the rotation of the handle to achieve the curve. Do a curved incision now. Next, through this thicker tissue with fat underneath the skin, I'm going to demonstrate a straight, deep cut. And so I'm changing to a butter knife grip. Now, in surgery and in dissections, for deep cuts, you never should be cutting where the handle is joining the scalpel blade. That means that you're going to be tearing the tissues on the side rather than cutting through. While that would cause trauma in a wound and cause a reduction in the quickness of healing, in the dissection it can ruin your specimen and what you're trying to see. And now the deep incision with the butter knife grip, remembering that even though this is a deep incision, I should not be going further down than where the handle meets the blade. Next, I'm going to demonstrate how to separate skin from a specimen. And this is where students typically struggle most during their dissections. The number one tip that I need to remind students about is that you want to keep the skin in one piece as much as possible. It gives you more to grip. You shouldn't be trimming off pieces of skin as you move along. It is going to make things more difficult. In a surgery, they're typically removing skin to remove something underneath the skin, and they would only use that one incision still. And aside from a scalpel, they might use dissection scissors by putting the scissors underneath the skin and then opening them up to separate the skin from the underlying cyst or tumor that needs to be removed. What I'm separating here, what was connecting the skin to the muscle, is called areolar connective tissue. It's a loose connective tissue. It kind of looks like cobwebs and is a little bit more firm than cobwebs. For dissection, in addition to the one incision, we typically have one perpendicular to it. Because I didn't make that earlier, I really can just use the scissors to cut through the skin. In addition to using the scissors like I showed before, in a dissection, you can use the blade of the scalpel at the correct angle to scrape the tissue away from the skin. I'm not pushing in, that would be cutting the skin. I'm keeping it angled away. With the goal being to remove only the skin and keep the underlying muscle intact. So I'm not cutting the skin away, cutting off pieces of skin, I'm only cutting deeper in to allow greater access. Now you can see similarly, separating this rind of the lime, it's got some connective tissue holding it in. And if it doesn't separate easily, you can use the scalpel, making sure to peel the skin up so that you really see where it's connected and you're not cutting the skin or the underlying tissues. Separating this white tissue from the pulp underneath. It's very similar to separating the skin earlier, the very thin skin. Now that I've got enough of this skin removed, I can show you the last piece. The last tip that we wanted to give you today is about how to isolate structures to view them better. Here there are a few muscles. They're still connected by connective tissue. And you want to really be able to isolate things and know what is separate from what. And there are a couple of ways to do that. First would be to try to get underneath them or separate them using a dull probe. You can see as I apply some pressure with the dull probe that the connective tissue linking them separates. So here, using the dull probe and the scalpel a little bit, I was able to separate the biceps from the triceps and this band of blood vessels that was between the two. You can still see that you would be able to separate from muscles and things that are deeper down and from the bone, really by teasing out and looking at where things are connected and very gently either pulling apart connective tissue or very gently with a pencil grip or reverse pencil grip using the scalpel. The dull probe can also be used to isolate the structures here, similar to with the chicken wing. Finding natural breaks between sections. Before it was muscles, but here segments of the lime, and applying pressure to separate them and work your way through any connective tissue that was holding them together. And when you need to, very gently cutting through thicker connective tissue. One last tip isn't about something to do, but rather something not to do. Scalpels are not meant to be used as saws. There should never be any going back and forth. Only if you were doing a deep cut and working your way through something would any back and forth motion be appropriate. But never to cut into something. This is not appropriate. Now, when you're done, you'll use the mosquito forceps to grip the back of the blade, peel it up, push it forward, and put it into the sharps container safely. Well, thanks for watching. Get lots of practice in class on these low-stakes specimens so that once we're working with things that we really want to look at or really want to work with, that those skills are sharp for you and that you'll be able to see the structures you need to. I'll see you in class. Bone apple tea.